Bismillahirrahmanirrahim. Hello everyone. Welcome to today's lecture on sensory nerves of the face. The skin of the face is supplied by the branches of the three divisions of the trigeminal nerve, except for the small area over the angle of the mandible and the parotid gland, which is supplied by the great auricular nerve. So basically, the skin of the face, all of the skin of the face is the sensory supply, is basically by the branches of the three divisions of the trigeminal nerve. The three divisions of the trigeminal nerve. Except for the small area over the angle of the mandible and the parotid gland, that is supplied by the auriculotemporal nerve. And now the overlap of the three divisions of the trigeminal nerve is slight as compared with the considerable overlap with the dermatomes of the trunk and the limbs. Now the ophthalmic division, basically the ophthalmic division supplies the region which is developed from the frontonasal process, and then the maxillary division serves the region which is developed from the maxillary process of the first pharyngeal arch, and then the mandibular division supplies the region which is developed from the mandibular process of the first pharyngeal arch. So we move on to the divisions. The ophthalmic division, which is the first division of the trigeminal nerve, it basically supplies the skin of the forehead. So it supplies the skin of the forehead. Then it also supplies the upper eyelid, It supplies the conjunctiva, and finally the side of the nose, and down to including the tip. So side of the nose, side and tip of the nose. All right, so the ophthalmic nerve basically has 5 branches: the supraorbital nerve, the supratrochlear nerve, the lacrimal nerve, the infratrochlear nerve, and the external nasal nerve. These are basically 5 branches of the ophthalmic division of the trigeminal nerve. We can basically try to trace these branches. So this is basically where the supraorbital branch comes out from. This is a supraorbital branch, and this is basically the supratrochlear branch. So this is the supratrochlear branch, and then the lacrimal nerve. This is the lacrimal nerve. The infratrochlear nerve. This is the infratrochlear nerve. And finally, this is the external nasal nerve. Okay, so now we are done with the areas that are supplied by the ophthalmic division and its 5 branches. Let's move to the next division, which is basically the maxillary division. So the maxillary division supplies the skin of the posterior part of the side of the nose, the lower eyelid, the cheek, the upper lip, and the lateral side of the orbital opening. So the maxillary nerve supplies the skin on the posterior part of the side of the nose. It supplies the lower eyelid, the cheek, the upper lip, and finally the lateral side of the orbital opening. Now, the maxillary division, it basically has three main branches: the infraorbital nerve, the zygomatico-facial nerve, and the zygomatico-temporal nerve. So it has three branches. The infraorbital nerve basically is a continuation of the maxillary nerve itself. This is the maxillary nerve, and when it comes out through the infraorbital foramen, it's called the infraorbital nerve. The zygomatico-facial nerve. This is the zygomatico-facial nerve. And finally, the zygomatico-temporal nerve. So this is the zygomatico-temporal nerve. Alright, so let's move to the mandibular division. The mandibular division is the third division of the trigeminal nerve, and it supplies the skin of the lower lip. So it supplies the skin of the lower lip. It supplies the lower part of the face. The temporal region. And a part of the auricle. The mandibular nerve has three branches. The first one is the mental nerve. The second one is the auriculotemporal nerve, and the third one is the buccal nerve. Now let's trace these branches. The mental nerve. Basically, the inferior alveolar nerve, when it comes out through the mental foramen, it becomes the mental nerve. So this is the mental nerve. This is the buccal nerve. And this is the auriculotemporal nerve. So this finally brings us to the end of sensory innervation of the face.